Over 60, stop eating these vegetables. They can raise stroke risk, overnight, doctor explains. If you're past 60, picture this. You turn in after what seemed like a smart dinner, maybe a crisp salad, a plate of steamed veggies, feeling satisfied with your choices. By morning, something was wrong. Your speech feels thick. Your arm seems weak, or you wake suddenly with unexplained dizziness. Most people blame fried foods or sweets. Here's the unsettling twist. Sometimes the trigger is a vegetable you believed was protecting you. Yes, a vegetable one long praise for heart and brain benefits can after 60 quietly nudge your stroke risk higher overnight. I've witnessed this scenario again and again working with older adults. Foods that serve you well at 40 can work against you at 70, especially when they interact with common medications or are eaten at the wrong time. The encouraging part is you don't have to be afraid of food. You simply need to understand how an aging body processes it differently. In today's video, we're uncovering 9 everyday vegetables that can subtly elevate stroke risk if you're over 60, and even more importantly, how to keep enjoying them safely. Stay with me to the end because the final vegetable is one most seniors eat every single week, and it may be the most concerning of all. Let's start with a vegetable you've likely considered a trusted ally, yet, after 60, it can turn into a quiet threat to your brain. 1. Tomatoes. They're often treated as the poster child for clean eating, light, refreshing, and rich in antioxidants. Yet after 60, this everyday staple can subtly disturb circulation in ways that mimic stroke symptoms. Tomatoes are nightshades, and they contain compounds such as histamines, tyramines, and solanine. In aging bodies, these can spark inflammation, cause blood vessels to constrict or dilate unpredictably, and disrupt nerve signaling in brains and arteries that are already more delicate, leading to dizziness, headaches, or numbness that can resemble early stroke warnings. Their natural acidity can also influence electrolyte balance by drawing down calcium and magnesium minerals essential for steady nerve and muscle function. In larger portions, especially late in the evening, that shift can trigger blood pressure swings and sluggish circulation during sleep. None of this means you must give up tomatoes. Cook them gently to lower solanine content and to make antioxidants like lycopene easier to use. Skip heavy tomato-based dinners close to bedtime and enjoy them earlier in the day instead. Pair tomatoes with magnesium-rich foods such as pumpkin seeds or spinach to help buffer acidity. Tomatoes still deliver heart-supporting nutrients. After 60, the key is moderation, timing, and paying attention to how your body responds. Enjoy them wisely so they remain an ally rather than a quiet trigger. 2. Asparagus. It is often viewed as a very clean, light, and elegant choice, a regular feature in health-focused mealtimes. After age 60, however, this refined side can quietly create circulation problems if it is eaten at the wrong time of day. The reason is simple: asparagus works as a natural diuretic, encouraging the body to release water. In younger adults, that effect is usually insignificant. In older adults, it can set up overnight dehydration, thicker blood, and slower blood flow, especially when paired with blood pressure medicines or other diuretics. More concentrated blood travels sluggishly through aging arteries, increasing the chance that small clots may limit oxygen delivery to the brain during sleep. The solution is straightforward: skip asparagus late at night. Choose it at lunch or in the early evening while you are still active and hydrating. Have a glass of water or include hydrating foods like cucumber or melon with the meal. If you take medications for blood pressure or kidney issues, ask your doctor whether asparagus could amplify those effects. Asparagus remains rich in vitamins and antioxidants that support heart and skin health. Like many foods after 60, it calls for timing and balance. Eat it earlier, stay well hydrated, and you can keep the benefits without inviting hidden overnight risks. 3. Corn. For many older adults, it is the definition of comfort: corn on the cob, a warm bowl of grits, a ladle of corn soup. It feels familiar, soothing, and harmless, yet here is the part most people overlook. From a nutrition standpoint, corn behaves more like a starch than a typical vegetable, and after 60, that distinction matters. When you eat corn, its natural sugars are converted to glucose, quickly producing sharp rises in blood sugar, much like a slice of white bread. In seniors with slower insulin response or less robust circulation, that roller coaster can quietly increase strain on the heart and raise stroke risk. The surge is often followed by a dip, and that drop triggers stress hormones such as cortisol and adrenaline. Those hormones constrict blood vessels, thicken the blood, and create conditions in which small clots can form overnight. You do not have to give up corn. You do need a smarter plan. Skip corn at night when activity is lower and dehydration is more likely. Pair it with protein or healthy fats, eggs, avocado, or beans to slow absorption and smooth out blood sugar. Think of corn as an occasional side, not an everyday anchor. Choose fresh corn on the cob over processed options like cornflakes or cornmeal, which digest even faster and spike sugar more sharply. Corn may taste simple and sweet, but after 60 your body treats it differently. With a little balance and better timing, you can still enjoy it, just less often and not late in the day. 4. Onions. They are rich in antioxidants and compounds that protect the heart, helping lower cholesterol, calm inflammation, and support healthy circulation. After age 60, though, especially for anyone taking blood pressure medicines or blood-thinning drugs, onions can quietly cause problems when eaten in large quantities or at the wrong time of day. The key player is quercetin, a natural compound in onions that relaxes blood vessels and can reduce blood pressure. In moderation, that's helpful, but paired with prescriptions that already lower pressure or affect clotting, the combination may push levels too low. For older adults, this can mean less oxygen delivered to the brain, raising the chance of dizziness, fatigue, or confusion. Overnight, when hydration typically declines and blood flow slows, that mix can set the stage for a fainting spell or even a mild stroke. You don't need to cut onions out, you need to use them wisely. Keep them as a flavor accent rather than the star of the plate, and favor cooked onions over raw, since heat diminishes quercetin's potency. Skip onion-heavy evening meals when circulation naturally tapers, and make a point to stay well hydrated through the day. If you take medications for blood pressure or circulation, let your doctor know how often you eat onions, so small dosage adjustments can be made if needed. Onions remain a terrific addition to a healthy diet, but after 60 they call for balance. A modest amount adds protection and flavor. Too much at the wrong time can quietly strain your brain and your circulation. 5. Garlic. For centuries, it has been celebrated as one of nature's potent remedies, helping lower blood pressure, supporting cardiovascular function, and bolstering immune defenses. After age 60, however, especially if you take anticoagulants, garlic can shift from protector to potential problem. Here is the reason. Garlic naturally thins the blood. Its allicin and sulfur-containing compounds reduce clot formation and help blood move more freely. That's beneficial unless you are already on prescription blood thinners, such as warfarin, clopidogrel, or even a routine aspirin. In combination, the effect can make your blood too thin, leaving delicate brain vessels more prone to bleeding. The consequences may include dizziness, easy bruising, nosebleeds, or in severe cases, a hemorrhagic stroke. The answer is not to abandon garlic, but to use it thoughtfully. Avoid concentrated garlic supplements unless your physician specifically approves, and favor small amounts incorporated into cooked dishes. Heat tempers garlic's anticoagulant punch and is gentler on the stomach. Stay alert for early clues that your blood may be overly thin, unusual bruising, persistent headaches, or fatigue, and make adjustments with your doctor's guidance. Garlic remains a remarkable gift from nature. After 60, treat it with the respect you would give a medication. Used wisely, it strengthens your heart. Used carelessly, it can quietly put your brain at risk. 6. Raw carrots. Carrots have long been seen as an ideal snack, crisp, low in calories, and rich in beta-carotene to support eye health. After 60, however, eating raw carrots at the wrong time can quietly complicate circulation and brain function. Here is the mechanism. Raw carrots are digested quickly and release natural sugars into the blood. Younger bodies usually buffer that rise without trouble. In older adults, especially those with prediabetes, diabetes, or a slower metabolism, that rapid increase can set off a cascade. Blood sugar climbs, then dips during the night. That overnight drop prompts stress hormones like cortisol and adrenaline to surge, tightening blood vessels and pushing blood pressure upward precisely when the body should be at rest. Add mild dehydration, and the blood becomes more concentrated, creating conditions that favor tiny clots and reduced blood flow to the brain. The remedy is straightforward. Do not eat raw carrots by themselves or late in the evening. Choose them earlier in the day and pair them with protein or healthy fats such as hummus, nuts, or yogurt. This combination slows sugar absorption and keeps energy steadier. Carrots still offer valuable vitamins and antioxidants. Just keep in mind that after 60, even wholesome foods benefit from timing and balance. Carrots by day can help, carrots before bed can quietly hinder. If this video is helping you so far, take a moment to like it so more seniors can discover these health tips. Subscribe to Healthy Care for more videos that keep you strong, sharp, and independent. 7. Romaine lettuce. For many older adults, a simple dinner salad feels like the perfect responsible choice. It is low in calories, easy on the stomach, and kind to the heart. What often goes unnoticed is that eating romaine late in the evening can nudge stroke risk upward by the next morning. Here is the reason: romaine has a mild diuretic effect, prompting the body to shed water. In younger people, this makes little difference. After 60, however, kidney filtration slows, blood vessels lose elasticity, and thirst cues become less reliable. You may not sense dehydration yet. As you sleep, your blood can become more concentrated. Thicker blood travels more slowly through aging arteries, which makes it easier for small clots to form. That risk rises further when romaine is combined with blood pressure medicines or diuretics that already influence fluid balance. None of this means you must give up salads, it means timing matters. Choose romaine at lunch or earlier in the day when hydration and circulation are stronger. If you prefer greens at night, drink a small glass of water alongside the meal to help maintain smooth blood flow. Romaine lettuce still supports cardiovascular and digestive wellness, but after 60, the clock matters as much as the plate. Eaten late, it can quietly tax your brain and circulation. Eaten the right way at the right time, it remains the crisp, refreshing ally it is meant to be. 8. Broccoli. For years, it has been held up as a heart-smart staple, loaded with fiber, antioxidants, and vitamins that support immunity and healthy aging. After 60, though, it can become a quiet risk, not because broccoli is harmful in itself, but because of how it can interact with medications many older adults take. The key factor is vitamin K, a nutrient that supports normal clotting. That's helpful earlier in life, but if you're on blood thinners, especially warfarin, and sometimes alongside drugs like Plavix or aspirin, large erratic intakes of vitamin K can upset your medication balance, tipping your blood toward being too thick or too thin. That delicate equilibrium can be the line between steady circulation and a stroke. The real hazard is inconsistency. Eating heavy portions of broccoli one week and almost none the next can nudge your treatment levels off course without obvious warning. You may feel perfectly fine until numbers swing, your blood pressure jumps, or your blood becomes too thin to clot effectively. The safe path is simple: keep your broccoli intake steady rather than extreme. There's no need to eliminate it, just avoid sudden shifts in how much you eat. Make sure your clinician knows what you typically consume so doses can be tuned appropriately. Broccoli can still be a powerful ally for your heart and brain. After 60, it just needs to be eaten with consistency and awareness. A little day-to-day balance goes a long way toward protecting your circulation and your future. 9. Spinach. For years, it has worn the crown of superfoods, celebrated for its iron, magnesium, and powerful antioxidants. Yet, after age 60, this trusted staple can flip from helper to hazard when it's eaten the wrong way. The issue centers on oxalates, naturally occurring compounds in spinach that latch onto calcium. In younger bodies, healthy kidneys sweep these compounds out with ease. With aging, though, kidney efficiency declines, blood vessels lose flexibility, and many older adults add calcium or vitamin D supplements to their routine. That mix lets oxalates and calcium join to form microscopic calcium oxalate crystals in the bloodstream. Those crystals can gradually accumulate and constrict the tiny arteries that supply the brain, much like grit settling inside a narrow tube. As the passage tightens, blood flow drops, oxygen delivery slips, and a small clot can set off a silent stroke, often noticed only after waking. This does not condemn spinach. It signals that after 60, your metabolism handles it differently. A safer approach is to enjoy spinach earlier in the day, at breakfast or lunch, when your body is better able to process it. Limit frequent pairing with calcium or vitamin D supplements, and speak with your clinician if you have kidney or cardiovascular conditions. Spinach is still a nutritional heavyweight, but it comes with guidelines as you age. Follow those guidelines, and it remains protective. Ignore them, and it may quietly undermine your brain while you sleep. Now that you've heard the hidden downsides of these 9 vegetables, it's natural to feel surprised, maybe even unsettled. We've grown up with the idea that vegetables are uniformly beneficial, and in general they are. But past 60 physiology shifts, kidney filtration slows, blood vessels become more delicate, hydration patterns change dramatically. Even the most wholesome foods can behave differently in an older body. The question is no longer only what you eat, it's also when you eat it, how much you choose, and what you pair it with. A midday salad can be fortifying, while the same greens at night may quietly thicken the blood or drop your pressure too far. Garlic used in cooking supports the heart, yet concentrated garlic pills, layered on top of medications, can thin the blood to a dangerous degree. The real pillars of longevity are timing, balance, and awareness. You are far from powerless. The more closely you understand your own physiology, the more influence you gain over your well-being. With small, deliberate adjustments, drinking enough water, shifting meal times, and staying alert to how foods interact with prescriptions, you can keep enjoying the flavors you love without anxiety. Awareness is not about deprivation, it is about choice. This video is intended for education only and does not replace professional medical guidance. Each person's health profile is different, particularly if you use prescription medicines or manage chronic conditions. Before changing your diet or altering supplements, consult your physician or healthcare team. Paying attention to how you feel and partnering with your clinician remains the safest route to long-term well-being. Today we explored 9 everyday vegetables that can raise stroke risk when used the wrong way, from spinach and broccoli to asparagus and tomatoes. Keep in mind, these foods are not foes. With sensible timing, moderate portions, and awareness of hydration and medication interactions, they can continue to protect your brain and fortify your body. Now, I'd like to hear from you. Which item on the list surprised you most, and will it change how or when you eat it? Share your thoughts in the comments so others can learn from your experience. If this video helped, please like it, subscribe to our channel, and consider tapping the super thanks button to support our mission to keep seniors strong, informed, and independent. What you choose for your plate today becomes the clarity, strength, and independence you carry into tomorrow. Stay sharp, stay safe, and stay vital. Aging is not about decline.